Hello and welcome to the video. In today's video, we are going to talk about Alzheimer's disease. This video will cover some basic ideas about Alzheimer's disease and is not intended to be granular. If you or a loved one is experiencing signs and symptoms of Alzheimer's disease, please see a doctor and/or encourage your family member to schedule an appointment immediately. This condition not only impacts the individual, but it also affects immediate family. Alzheimer's disease was first described by a German psychiatrist and neuropathologist named Alois Alzheimer. In 1906, he presented the case of a 51-year-old woman named Augusta Dieter, who had a peculiar disease of the cerebral cortex. This case marked the first diagnosis of what would later be known as Alzheimer's disease. As of now, Alzheimer's disease is not curable. However, medical scientists are conducting research into this condition in the hopes of finding a cure. Now, let's move on to the video. Alzheimer's disease is a chronic neurodegenerative disease that typically starts slowly and gradually worsens over time. It is the most common cause of dementia, a general term for a decline in cognitive function severe enough to interfere with daily life. Alzheimer's disease affects memory, thinking, behavior, and the ability to perform everyday activities. Some key characteristics of this condition are memory loss. One of the most common early signs is difficulty remembering newly learned information. As the disease progresses, individuals may experience severe memory impairment and lose the ability to carry on conversations or respond to their environment. Cognitive decline. This includes difficulties with problem-solving, planning, and reasoning. Patients may also experience confusion with time or place, have trouble understanding visual images and spatial relationships, and have difficulty with words in speaking or writing. Behavioral changes. People with Alzheimer's may exhibit mood swings, changes in personality, and behavioral changes such as depression, anxiety, and social withdrawal. Lastly, neuropathological changes. The disease is characterized by the accumulation of amyloid plaques and neurofibrillary tangles in the brain, which interfere with neuron function and lead to cell death. Let's talk about the stages of Alzheimer's disease. There are 4 unique stages of this condition. Preclinical stage. Changes in the brain begin years before any symptoms appear. This stage can last for years or even decades. Mild Alzheimer's disease, early stage. Individuals may function independently, but have memory lapses and cognitive difficulties noticeable to friends and family. Moderate Alzheimer's disease, middle stage. This is typically the longest stage, where individuals may require increasing levels of care. Symptoms become more pronounced and behavioral changes are more noticeable. Severe Alzheimer's disease, late stage. Individuals lose the ability to respond to their environment, carry on a conversation, and control movement. They require full-time care. Diagnosis is based on a combination of medical history, physical examination, neurological exams, mental status tests, and brain imaging. Biomarker tests may also be used to detect the presence of amyloid and tau proteins. There is no cure for Alzheimer's disease, but treatments are available to help manage symptoms. These include medications, cholinesterase inhibitors, such as donepezil, and memantine can help manage cognitive symptoms. Non-pharmacological therapies, cognitive therapy, lifestyle modifications, and support for caregivers can improve quality of life. Research. Ongoing research is aimed at finding better ways to treat and ultimately prevent the disease. Understanding Alzheimer's disease is critical for developing better treatments and supporting those affected by it. Amyloid and tau proteins are 2 critical proteins involved in the pathology of Alzheimer's disease. Their abnormal accumulation and malfunction are hallmarks of the disease. Amyloid proteins. Amyloid beta, AV. This is a fragment of a larger protein called amyloid precursor protein, APP. In healthy brains, APP is broken down and eliminated. However, in Alzheimer's disease, this process malfunctions, leading to the accumulation of amyloid beta fragments. Amyloid plaques. The amyloid beta fragments aggregate to form sticky clumps or plaques outside neurons in the brain. These plaques disrupt communication between brain cells and activate immune responses that cause inflammation and neuronal damage. Tau proteins. Tau protein. Tau is a protein that normally helps stabilize microtubules, which are part of the cell's structure and play a crucial role in intracellular transport. Neurofibrillary tangles. In Alzheimer's disease, tau proteins become abnormally hyperphosphorylated and start to clump together, forming twisted tangles inside neurons. These tangles disrupt the transport system within neurons, leading to cell death. As we draw to a close on this video, it's important to remember a few things about Alzheimer's disease. Alzheimer's disease is a chronic neurodegenerative disease that typically starts slowly and gradually worsens over time. Memory loss, cognitive decline, behavioral changes, and neuropathological changes are all characteristics of this condition. There are 4 stages of this condition. They are the preclinical stage, early stage, middle stage, and late stage. Diagnosis is based on a combination of medical history, physical examination, neurological exams, mental status tests, and brain imaging. That will conclude our video on Alzheimer's disease. Please hit the subscribe button and notification bell to keep up to date with all of our videos. Big thanks for supporting the channel, and we look forward to your continued support. Feel free to share your thoughts and comments below. See you all in the next one. Until then, see you soon.